Yeah, my name is Michael. I'm a staff nurse in the acute mental health inpatient centre.
Hello, my name is Fanula. I became a nurse. I qualified in 2019 in mental health nursing.
Hello everybody, my name is Ryan Hunter and I'm a registered mental health nurse.
I've been working as a registered mental health nurse now for well over a year.
The reason I wanted to become a nurse, I worked in a mental health charity. I volunteered for them for a number of years and they put me through loads of training. And I realised it was something I really enjoyed doing, so I applied for Queen's and here we are.
My reasons for getting into nursing was from initially my time as a healthcare assistant, working in care homes, providing care for people's loved ones and the residents within those homes. It was from this that I decided that I wished to pursue the next step in the healthcare profession and become a nurse.
I always knew that mental health was sort of the pathway in which I wanted to go down. For many reasons. I myself experienced mental health issues. I've witnessed friends growing up who've went through those mental health issues, and also family who have went through mental health issues as well. So I felt like it's something that I experienced quite a lot, either witnessing it or personally experiencing it.
For me, for the past 3 years, some of the challenges that have become quite evident within the NHS and as a nurse has been the difficulty in retaining our own staff as a nursing workforce. Staff, for various reasons, have felt the need to leave the profession, perhaps to pursue full-time agency work, or perhaps to actually leave the profession as a whole. It's been well documented across the media that due to our staffing crisis across the NHS, indeed across the UK at present, that it hasn't been uncommon for nurses to be suffering from PTSD, depression and anxiety.
It's interesting working in the NHS because you very quickly realise that nearly all issues you'll ever face as a nurse and also as a service user and any other discipline that you will work being in the NHS, it is almost always caused by staffing levels, which obviously we're experiencing a staffing crisis at the moment. This year has been probably the worst in terms of staffing in a very long time.
And I think the challenge that we face that is directly relating to the strike is the staffing crisis that is happening in the UK, and obviously we're talking about Northern Ireland. It's not good enough whenever we are going into a day and we don't have enough nurses to really work with the patients. Yes, we can keep patients safe, and sometimes that is where it ends on certain days. Patients are in here to try and get some sort of therapy alongside the medications that they're prescribed, and sometimes we can't do that. With the staff that we have on certain days, we are not able to actually provide, maybe one-to-one therapeutic conversations or to carry out a certain part of their treatment plan, because all we're looking to do is, right, are the patients all here? Are they safe? At the end of the day, is everyone here and accounted for? And that is the reality.
I fully support the nurses' strike. I just think the NHS is under so much pressure at the minute, and especially working in a mental health unit. When we have low staff, it is our patients that directly get affected, our patients' safety and the safety of others on the ward, including staff.
Due to these staffing levels, patient care at times has been difficult to give 100% in a safe and effective way. It is therefore, in my opinion, that strike action is indeed legitimate and indeed required for nurses.
And I'm really hoping that these strikes can bring about more reward for the nurses who are working within the trusts and within NHS to keep them on the wards, because that is exactly what is needed.
So obviously talking about safer staffing levels, I think that's probably the main thing that I would change. We need safer staffing in order to have a safer environment for our service users. It's very simple, and the government know very easily what's going to keep safe staffing levels, what's going to reduce the likelihood of nurses leaving the NHS in these large numbers.
I think one of the things that would be good for nursing as a profession to change and to retain the staff is to make there more of a pathway for newly qualified nurses, band 5s or band 5s who've been nursing for 10 or 15 years, make there more of a pathway to progress up in ranks. Other professions have it where after a year or two they're automatically a band 6, but nurses don't, which I don't think is fair.
One thing I would change is maybe, I'm not too sure, just if our nurses were paid a fair wage, it would cut down the amount of agency that is being used on the wards. It would entice more nurses to apply for permanent posts, and therefore our staffing levels would improve overall. So yeah, I fully support the nurses' strike. Thank you.